Hello and welcome to today's episode of Community Connections, airing right here on OROMIA11. I am your host, Anna Orr, and today's guest is Dr. Tolulope Manisola Ola. She is the founder and executive director of Restoration for All Incorporated, a nonprofit organization with the mission to nurture and empower individuals, organizations, and communities to renew, discover, and restore their culture of well-being. She is a mental health practitioner, African storyteller, and an advocate for cultural healing through mind, body, and spirit practices. She is a co-chair for the Mental Health and Wellness Action Team of Ramsey County Public Health. She is a public health expert with experience in empowering and mobilizing communities to bring about social change through health, education, sensitization, and advocacy to create an environment that is physically, socially, and culturally inclusive. Please help me welcome Dr. Ola. I am so happy to have you joining me today, Dr. Ola.
Thank you so much.
Now, this is April, and we are wrapping up what is considered National Minority Health Month. And I don't know if a lot of people necessarily know what that is, but it is where the primary focus is around minorities and their mental, physical, and spiritual health, all around well-being. Mm-hmm. So I'm so excited to have you here as a representative of Restoration for All Incorporated.
Thank you so much.
Absolutely. Now, for those that may not be familiar with Restoration for All, or REFA as you all are lovely nicknamed, can you talk to us about the work of REFA?
Thank you so much for inviting me.
Absolutely. And
I would really love to share about Restoration for All, Inc. Restoration for All, Inc. started in 2018 March, and it started because of some of the things I saw in the community that were missing. And I thought, okay, how is it possible for us to bridge this gap? Because I came in 2014 and I saw a lot of people talking about mental health, treatment and rehabilitation. Nobody's talking about prevention and promotion. So I thought it's important for us to really look at how people perceive their mental health, how they take good care of themselves, physically, spiritually. And I saw that culture, it's very important, it matters. So I started Restoration for All in 2018. And our mission is to reconnect individuals, organizations, communities with their cultural heritage using cultural strategies. And that's what we've been doing since we started.
Now, you talked about some of the things you noticed where there were some deficits.
Mm-hmm.
What were some of the deficits that you were experiencing that you felt like you specifically wanted to target or you wanted to bring awareness to?
Okay, the first one that I would talk about is culture. You know, we came into this country from our country of origin.
Absolutely.
With our culture. And, you know, we got here, we met another culture. And that's the beginning of the cultural shock, acculturation stress. A lot of people would want to dump, you know, and do away with their culture and would really like to take up the culture of their destination country. But I discovered there is a need for us to preserve our cultural heritage. Culture goes beyond the clothes we wear. It goes beyond the food we eat. It's all about what we carry, and we are culture carriers. So being culture carriers, we cannot afford to leave our culture and, you know, take up the new culture. And that's where the conflict begins. When we are trying to do away with our culture and pick up the American culture, it becomes a problem. People lose their cultural identity due to this. People lose their sense of belonging due to this. You want to be, you know, Americanized. Let me call it that. Because you have this expectation that when you get to America, I want to talk like Americans. I want to behave like Americans. I want to eat the food that the Americans are eating. And then you want to forget about our local food. You want to forget about the African prints that we wear. So I came up with this organization because I don't want people to lose their cultural heritage. And that was what we've been doing since we started.
Now, Restoration for All, Inc. focuses on doing that work in 3 specific ways.
Sure.
Awareness, connections, and well-being.
Mm-hmm.
Can you talk to me about those 3 integral focuses?
Thank you so much for that very good question. You know, awareness, it's all about knowing, getting information, and then bringing to the conscious from your subconscious. That is when awareness actually happens. So I discovered that a lot of people, they've lost touch. They don't even have the necessary information about things going on in the community. Information is power. Using that information is more powerful. So we decided it's important for us to create awareness around the way we want our mental health to be addressed, the way we want the services to be culturally appropriate and relevant, and also the way we want people to really reconnect with our culture of healing. Cultural healing practices, singing, drumming, you know, a lot of other things that we do back in Africa or back in our home country that really helps us to get over our stressors. We need to really bring people to do that. Talking about the second one, which you talked about, awareness is the first. Second one is connections. We know it's important. When a lot of people are disconnected, it means you are disconnected from things that really matters to you. Mm-hmm. And we try to bring that social connection where we bring people together to talk about things. We do a lot of talking circles. It's not for us to open people's wounds and leave them to go and, you know, do whatever they need to do to the opened wounds. We bring them into that circle. We listen to their circle of, we come together in a circle of that concern, and then we come up with solutions right there. This is happening to you. You are not the only one. We've had people, they've been here before, things happen to them. That's the essence of social connection. We don't want people to be disconnected from their culture. We don't want people to be disconnected from people they are familiar with, from traditions and norms that they are familiar with, and the values that they really, you know, honor and appreciate. So we need to really bring people together to connect spiritually, connect physically, connect even, you know, in every other forms and ramifications. So that's the essence of what we do in our work as an organization. And the last one is
well-being.
Well-being. And I think I talked a little about that. Well-being, it's an individual thing. But sometimes we need to do it collectively too. People talk a lot about self-care, collective care, and they don't really know how to do that. I know in my, you know, community, people don't take time to do self-care. We keep working and working and working until we cannot work anymore. We have, you know, done a lot around that to educate people. Take time off. You need to, you know, the work will wait for you.
Say that again, please.
Yeah, you need to really do self-care.
That's true.
The work that you're doing will wait for you. You know, if you die or if anything happens to you, someone else will take over from you. So instead of you just working yourself and grounding yourself, why don't you take time off, 2 days, 3 days, and then you come back refreshed? You are able to do more when you are refreshed, you know. So well-being, we know it's personal, we know it's collective. We work with people to really work around that in every way possible using cultural strategies. I talked about drumming. I talked about talking circles. I talked about dancing. I love dancing, you know, moving your body. It fulfills your spiritual wellness area. It's also good for your physical wellness.
True.
And also intellectually, you know, the movement, you need to be calculative if you don't want to fall down while dancing. So that's important too. So that's what we do around well-being as well.
And what has been the reception of the community from experiencing the talking circles and some of the other things, some of the dancing and different cultural norms that you guys have been reviving but also keeping alive at these events? What's been the reception of the community? So
when you come up with an organization like I did, it's not always easy to get people to believe in you, but you have to keep going. Build success, people we associate with your success. So we started, it was difficult in the beginning to convince people that culture is important. They know, but they are, thinking, how can you bring out this culture as a topic and people will not really look down on your culture? So we started building, we kept doing what we need to do. Instead of staying in an office, I was always in the community. Because when we say we have community events, it has to be bottom-up approach. You can't stay in an office and say you are having a community event. You need to be there. You need people to know what you do. You need people to understand the niche you are creating. You need them to know what's different about this organization. We have so many organizations working around culture, but the way we approach culture is different from any other organization. And what is that? We reconnect people with their cultural heritage. For kids who are born here, second generation kids, we tell them, this is your culture. You need to learn more. And the learning starts from the family. So we work with parents. We try to build cultural connections around that. Remind parents, you left your country years ago, but you can still do things the way it's been done back in Africa or your country. So that really helped. It gave those kids that sense of belonging that they need. The cultural identity that they are confused about, we were able to work on it. So I'm an African, I'm from this country, we wear African prints. When COVID came, we did a lot of masks and, face masks and, a lot of other things that we did that were culturally appropriate. And that really helped to really build that cultural connection that our organization is out to do. Yeah.
I was going to say, I know here in the Twin Cities, we have such a diverse landscape of people and languages, but when people come here, we don't always see people that look like us or that look like people from back home. And so often you're looking for community. You're looking, you're listening for your language. You're looking for your food in the grocery store, places where you can buy food like you used to eat at home. And for many people, they don't know where to begin. So it sounds like the work of Restoration for All is really timely and really important.
True.
Now talk to me about how mental health and culture go hand in hand when we know that from, in being women of color, that it's sometimes seen as a taboo to address your mental health.
Sure. Yeah, thank you for asking. So I've been able to do my research and also try to see where the gap is. Sometimes it's so difficult to see that thin line where culture and mental health meets. But one thing is, it's so easy for you to be labeled as having mental health issues when you are actually being cultural and being yourself. Just because someone doesn't understand where your culture starts from, what's all about, it's so easy for them to judge or probably label you. I'm going to give you about 2-3 examples of kids who have lived in the refugee camps. When they are relocated here, sometimes they are, relocated successfully, but they are not successfully integrated. Why? The first point of contact is the school. And teachers who are not really trained to work with refugee kids will not understand their behaviors, and they tend to label them. For example, kids that will not sit in a place throughout the day in school, teachers tend to label them that they have ADHD, but that's what they do throughout the day in a refugee camp. They don't sit in a place. They play all over, and these are some of the things. So as a woman of color, talking about mental health and culture, I want people to really understand that sometimes some kids who, you actually brought into the country as immigrant children, they will take some time. It's going to take some time for them to understand, especially in schools, what is going on, because they are used to what they normally do back in their home country, And culture is our way of life. It's the way we do things, the way we react to things, the way, we view things. And when these kids are acting in the way they know how to act, and we come around and say it's mental health issues, we need to take time and ask questions. Instead of saying what is wrong with you, we need to ask what happened to you, especially for kids who have gone through, a traumatic experience, kids who have experienced war. We cannot afford to judge them or label them. We need to take our time and listen, watch, observe to see what is different about them and why those things are really different about them. So, yeah.
I think you're absolutely right about that. Now, you've talked a little bit about some of the services and some of the programming, but can you talk about the wraparound services that you guys offer? You guys have programs for elders, for girls,
Yep.
for kids, for the family all together. Can you talk about some of the services and how they actually connect back to the work that you've talked about earlier?
Yeah. So the wraparound services that we do, we didn't start, since the inception of the organization. We try to develop our programs and services as needed.
Yeah.
Once we see a need in the community, we come back, and we design programs and services to meet those needs. For example, mental health, we started with that. But when COVID came and we saw that there was not so many culturally specific organizations helping, we came forth and designed a program which is actually working really well right now, because I think with the MDH program that we are participating in, we've had a lot of people vaccinated, even at the mosque.
Oh, that's wonderful.
A lot of people. It was not easy to convince people, but we actually worked with gatekeepers. We work with cultural liaisons. We also went there to convince them. Even we don't speak the language in some communities, we get interpreters, we get translators, just for us to really get the message across. Awareness, information, outreach is really important in this work. When you do community work, you can joke with the outreach and engagement piece of it. So that really helped. Also, we noticed that there are so many elderly people coming to the country to visit with their kids, and sometimes they decide to stay, to help with childcare and also help with other things. And we know that disconnection is there. They are isolated in a way. There is no social connection happening except they go to churches or mosque. But we saw the need for us to design a program that will help with healthy aging, and also with the caregivers who are supporting people that are diagnosed with dementia.
That is so important.
Yeah, very important for us to do that, and it's working really well. And we created an atmosphere where people can talk about what they are going through. For the elderly, how we need to bridge the gap, the intergenerational gap. We have been able to do that through some of our programs. And also, we came up with the child care program called the Family, Friends and Neighbor Program, because when COVID came, all the child care centers closed, and it was family members, friends, and neighbors that are helping with child care. And DHS, supported us just to help support those people that are doing that work, just to help, really bring resources to them and how they can get licensed in case they want to become licensed. We are supporting people to do that. So bringing everything together, we noticed that, immigrant issues, refugee issues is not just one. It's a complexity of so many things. But once you are able to take care of one, it's possible you would have addressed the other ones. For example, you want to work, you want to have more financial freedom to do things, you want to be self-sufficient, but you don't have a place to keep a child.
Right.
If you are able to leave that child with someone to take care of that child, it's easy for you to go out and come back to meet the child. It's going to take care of your mental health. It's going to take care of your emotions. You won't be bottled up when, your partner comes back home.
Right.
And, this is how we really do the wraparound services that we do. take care of one and then see the possibility of that one taking care of the other things.
I was going to say, it really is a domino effect if we
that is it.
are giving kids the benefit of intergenerational living, being around an elder or someone culturally similar to us, and someone safe. They're able to learn one from another. We're also giving the elder socialization and probably getting them up and moving, which is good for their physical health, as well as alleviating the financial burden, which we all are being affected by, with inflation being what it is right now and daycare costs being so high. I think this is so important to see the benefit as it links one to the other. Now, we've talked a little bit about Restoration for All, Inc., but you all have an event coming up that you are sponsoring, taking place the first week of May, Friday, May 3rd, and Saturday, May 4th, correct? Can you talk a little bit about this event? This is going to be a youth first aid, mental health first aid training, correct? Can you talk about the event and what people can look forward to?
Okay, so the Youth Mental Health First Aid Training is an 8-hour training where we train adults that are working with youth on the signs and symptoms to look out for when working with youth. And we saw that it was important to do this because we noticed recently in the immigrant community, Ghanaian community, Nigerian community, and also the Cameroonian community, we've had cases of youth dying by suicide. Of recent, I think 2 months ago, we had 2 kids in the Kenyan community. One died through hanging and the other one through suffocation, just 18. And we saw that there was that dire need for us to talk more about identifying the signs and symptoms of mental health in these kids. Because as immigrant parents, refugee parents, we don't know the signs. When a kid starts talking to you about feeling like they have butterflies in them, you think it's something else. Meanwhile, it's all about anxiety. When they tell you, I feel like there is a burden on my head, you know, people will not think about depression. We won't think about the isolation, the social disconnection. But, you know, when we train adults to recognize the signs and symptoms, they know the right thing to do. They know the referral process. They know where to look for resources. And, you know, thanks to Minnesota Department of Health, the Division of Suicide Prevention, we got a grant, a 4-year grant, just to help with this. So the funding for the training is from about 4 or 5 sources or funders. MDH, the program we're doing with the COVID vaccination, because we are actually doing something around comprehensive healthcare recovery. So they are funding that. The Minnesota Department of Health Suicide Prevention Subdivision, also Dakota County, Ramsey County. These are all the people that are sponsoring us to do the training, and it's going to be free for the attendees. For the 2 days, lunch will be provided and continental breakfast will be provided, and there will be a certificate for your participation so that you can actually talk to youth about their mental health. So
you shared with us that this event will be taking place. This will be an 8-hour training.
8-hour training.
This event will start at 10 a.m. and you'll be wrapped at 1 p.m. So people should come and plan to spend some time, but also to gain a lot of information over those 2 days. It'll be also in person as well as a hybrid, presumed, for the secondary half of the event, right? For people that may not be able to attend physically the entire time, you can still gain the information. I think it is so important that we're even having this conversation as we wrap up April and we head into May being Mental Health Awareness Month. It is so important. And I don't think we are cognizant all the time about how mental health is affecting our children. I remember when I was in school that we didn't have therapists on site in the schools. But now it is such a prevalent thing because of things you spoke of, kids dealing with anxiety, depression, suicidal ideations, bullying, exacerbate their time in school, and then they no longer want to attend, or they may then begin to thinking about self-harm.
That's true.
This is such a timely conversation to have.
Yeah.
I just want to talk a little bit about what mental health first aid is. Mental health, for those that may not know, mental health first aid is defined as the help provided to a person developing a mental health problem or experiencing a mental health crisis. The first aid is given until the appropriate professional treatment is received or the crisis resolves.
Yeah.
How many times have we been somewhere, or we've watched a video, or where you can see somebody's maybe behaving erratically, and we'll say, well, that's different, or, what's going on? Or somebody will say, this person is having a mental health episode, whether it's in a school, whether we see it in a grocery store, whether we see it involving law enforcement. This is becoming more and more prominent in our society.
Yeah.
What is your hope for Saturday's training?
So we hope to have a lot of people from the community, especially the faith-based community, to be part of this. And the reason is we know how important faith-based community leaders are. They are always the first point of call for
Absolutely.
most people that are, attending churches and mosques. They are always there to say, this is what I'm going through. Before they talk to their primary providers, they talk to the religious leaders first, the faith-based leaders first. So if we get them trained, instead of addressing issues brought to them spiritually alone, they know how to be included or involved in the referral process. So we are looking forward to having people from schools, from the community, especially faith-based leaders, to be part of this training on that weekend. Yep.
Now, people that are interested in coming to this event, is this event open to the public?
It is open
and if
to
so,
the public.
how do they register?
So
if they
we
want to
have
come?
a QR code on the flyer, and the flyer is on our Facebook page. We've shared it widely. It's sponsored on Facebook. So, definitely you see it. Absolutely. And if you have any problem registering, there is a number to call and an email that you can send a message to, and you get a response almost immediately. So it's open to the public.
We'll make sure that we provide that information as well at the end of this interview.
Okay.
Now, what can people look forward to on the day of the training?
On the day of the training, since we are splitting it into 2 days.
Thank you, trainees.
Yeah. So the trainees will be there. They will be made comfortable. It will be a very safe space to share. Anything we say in there, we keep it confident in case people are sharing personal stories. And also, people should be open and flexible to learn, because we're going to talk about the role of culture in understanding mental health too. And also, we will give them enough resources to go with in case they need to refer people. We are going to share resources with them that they can always leverage when they need it.
Now, we know that you guys are having this amazing training taking place the first week of May, but what else can people expect to come out as we head into summer from Restoration for All Incorporated?
So July 12th is going to be our 10th annual African Mental Health Summit.
Wow, okay.
We've had it, for the past 9 years, and this year is going to be celebratory because we've done a lot in the community around mental health. So we're going to have the summit and also a gala night, and it's going to be at the Heritage Center in Brooklyn Park. And, the save the date is out, and we look forward to having more people from the community attend. There will be scholarships, so people should be on the lookout for that so that they can join us without having to pay to attend. So we are looking forward to that.
I think that's wonderful, and hopefully before then we'll be able to have you back to promote that event.
That will be great.
Now, you did talk about that Restoration for All Incorporated is on social media. You all are on Facebook. Are you all on any other social media platforms? And if
Yes.
so, what or where can we find you all, under what usernames?
Okay, so for the Facebook is Restore for All. That for all is FOR.
Okay.
Restoration for All. Yeah. on Facebook. We are on Twitter. And I think that is Restore 4, number 4, all. And also our website is www.restoreall.org.
Okay.
And if you have any of our flyers, there is always a number or an email, a number to call or an email that you can send a message to.
Okay.
Yeah.
And then I just realized we never actually shared the location of where the youth and mental health first aid training is taking place.
Okay.
It is at the Fairview Wellness Hub, right?
Yes, it's taking place. We decided to look for a spot where people can actually easily locate.
Mm-hmm.
That location, I think it's easily accessible.
Yes.
And we got that space so that people can have free parking and also the space to really move around. So that's where we're using.
The address of Fairview Community Health and Wellness Hub is 45 West 10th Street in St. Paul, Minnesota. For those that are interested in attending the event, that will be where they are located on that Friday, May 3rd, as well as that Saturday, May 4th.
Yep.
Thank you for joining me, Dr. Ola. This has been
such
a necessary conversation.
Yeah.
And I appreciate the work that you guys are doing, not just here in the Twin Cities, but across cultures here in the greater metro area.
Thank you.
Absolutely.
Appreciate it.
Hi, my name is Oluwatomini Ola. I am the Program Manager for Restoration for All. Join us in making a difference in the lives of our youth by attending our Youth Mental Health First Aid Training. Learn crucial skills that can help you recognize and respond to signs of mental distress, potentially saving lives and promoting a healthier future for our community. Your participation not only supports mental health awareness, but also contributes to the success of our after-school program, Future Solution Now. Future Solution Now aims to foster resilience and well-being in our youth. Register today to empower yourself and support our mission to nurture the next generation. Be part of the change and help us create a brighter future for all. The first day will be at online, and then the second day will be at the Fairview Community Wellness Hub. You can find the link below.
That is all the time that we have for this amazing episode of Community Connections. A very special thank you to Dr. Ola and her amazing team at Restoration for All Incorporated. As always, I am your host, Anna Orr. This has been Community Connections, airing on OROMIA11. As always, I look forward to connecting again with you soon.
My name is Dr. Tolulope Monisola Ola. I'm the founder and executive director of Restoration for All. I'm here to talk about you getting vaccinated, especially with the COVID vaccine. You need to get vaccinated. COVID is still here. Wash your hands when you are in the community. If you don't feel safe, use your mask. And if you do not want to be vaccinated, please make sure that you help in a way by putting on your mask. Also, get tested. There are testing kits that you can use. We provide services around demonstration of how to use the testing kit. Please, we encourage you to still keep everyone safe in Minnesota. Thank you.